Good morning, everybody. Sue, thank you for that very kind, warm introduction. It is an honor to be back here at Rutgers University and to be here participating in the opening ceremony for the New Jersey Healthcare Industry Week. I guess the first healthcare industry week in the healthcare industry in New Jersey. So it's a very, very exciting day and a very exciting week. Excuse me. I have some proclamations to award later on in my remarks, and I didn't want to drop them and break them before I began. We have two very important responsibilities at the New Jersey Department of Labor and Workforce Development. The first is to help folks who are unemployed get back to work, and we have instituted a wide range of programs and services to help people to connect with opportunities, to connect with job training, to connect with networking opportunities, and we are very focused on helping both young people entering the labor market and folks making mid-career changes or folks who have found themselves unemployed, do whatever that we can at the department to help folks get back to work. Our second responsibility is very connected. It is to help make sure that we're building the most skilled, most talented workforce here in the state of New Jersey. As we all know, we live in a global knowledge-driven economy, and it is critical for our citizens and for all of us to have the best skills in order to be competitive and to have long, sustainable careers. And also from an economic development standpoint, perhaps our strongest strategic advantage in the state is our skilled workforce, our highly educated workforce that is very, very productive. And we know the Department of Labor and Workforce Development that we need to continue to work closely with educational institutions and all of our state partners to make sure that New Jersey is the home of the most skilled and talented workforce, not only in the United States, but also around the world. And so we know that we have to do those two things together to do both of them successfully. And so 2 years ago, we did the analysis and identified 6 key industries that really drive our economy. These 6 industries account for half of all jobs in New Jersey and 2/3 of all wages paid to our residents. Those are healthcare, which is represented here today, life sciences, technology, advanced manufacturing, transportation, logistics and distribution, and financial services. Those 6 industries are really the foundation for our state's economy. And so we decided that we needed to focus our attention at the department on those industries, to do a better job of understanding their workforce needs and working with all of our partners, our higher education partners, our K-12 partners, training partners, to make sure that we are preparing people at all stages of their careers for opportunities in those industries. So to provide the glue and provide the focus, we created 6 talent networks. Today we're here at an event created by the Healthcare Talent Network. But we have 5 other talent networks in those other 5 critical industries. We also are launching in the next couple of weeks a talent network focused on the hospitality, tourism, and retail industry, and an 8th talent network focused on helping us recover from Hurricane Sandy. So those announcements will be forthcoming. But there really are 3 critical roles that the talent networks play. The first is to do a better job, help us understand the needs of employers in these key industries. Sue Sherman mentioned the Healthcare Workforce Council, which is chaired by Bob Weiss from Hunterdon Healthcare and led by the State Employment and Training Commission under Michelle Barancas' leadership. And that group is working very, very close with all of us to do a better job of understanding the needs of employers in this critical industry. And we'll be working with the State Employment Training Commission to launch workforce councils for other key industries in the weeks and months ahead. So starting with really doing a better job of understanding where these industries are going, what are the skills that are needed, what are the occupations where we're having a shortage of workers, where we all need to work together to meet them. The second really important goal of the talent networks is to build the connections. They're networks. They're called networks for a reason. If we're going to have an efficient, vibrant labor market, we're going to have a skilled workforce, all of us have to work together. And I think you can see by the folks who are here today on this program and the folks in the room and all of the great presenters and folks who have tables, it really is a team effort to all work together. It starts with employers, the hospitals, doctors' offices, and other who are hiring people, understand what their needs are, and make sure that we're helping prepare workers. Education, higher education, colleges, universities, our high schools, training providers, all of us must work together. And the Healthcare Talent Network under Dr. Padma Arvind's leadership is doing a tremendous job bringing connections, making introductions between people who may never have interacted before, really helping us be the glue to work together. It's also important that we continue to do a better job of building connections between job seekers and employers. And I know a lot of the events here today and during this week are really focused on helping students and job seekers get better information about the labor market to make connections with employers and with educational institutions that might help them meet their goals. And then the third goal of the Talent Networks is really to help strengthen the talent pipeline, to make sure that our educational institutions have the information they need to make stronger curriculum decisions, to make sure that they're training people with the skills to be successful in the labor market, to build the pipeline of skilled talent and workers for our critical industries, to make sure that our job seekers and residents have the best career pathways, the best career opportunities available to them. So you can see it's an ambitious set of responsibilities, but our Healthcare Talent Network and our other talent networks are doing a tremendous job of building the connections and providing better information with which we all make better decisions. So it's again, it's an honor to be here on the opening ceremonies. Before I turn the stage back to the next presenter, I do want to take a moment and present proclamations from the Commissioner of Labor and Workforce Development. And so I'm going to ask Sue Sherman to join me up here on stage, and also Jay Jimenez of the St. Peter's Healthcare System to join me on stage as well, and I will present the proclamations. So as Jay joins us on stage, and Jay, thank you very much for all of the work of St. Peter's Healthcare System. So I'll read the proclamations, and then so whereas the healthcare industry is a dynamic segment of New Jersey's economy and an integral part of the state's quality of life and economic development strategy, and whereas healthcare is one of the 6 priority industry clusters in the state, whereas healthcare accounted for over 171,000 New Jersey jobs and contributed over $300 billion to New Jersey's gross domestic product in 2010, whereas from 1990 through 2012, the healthcare sector has added 180,600 new jobs, while all other industries have combined had a net increase of 79,800. So I just want to stop and make mention to that during that 12-year period, we had double the job growth in healthcare that we had in every other industry sector. And whereas we recognize the importance of a thriving healthcare sector in fueling New Jersey's economic growth and building a promising future for our state, whereas we recognize that New Jersey's healthcare workers are an important state asset and providing highly skilled, high-paying jobs which significantly contribute to New Jersey's standard of living and economic vitality. Now, therefore, I, Harold J. Wirths, Commissioner of New Jersey Department of Labor and Workforce Development, do hereby proclaim April 8th through April 12th, 2013 as Healthcare Industry Week. So congratulations to all of you involved in this event. Thank you for being here, and look forward to a great week of activities.